Good morning, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry with this week's edition of Dental Health with Dr. C. What I'd like to talk about to begin the year here is various ways that we can improve someone's smile. As we know, the smile is really important. So I'm going to first talk about the simplest one, bleaching. Now there are a myriad of ways that you can go about making your teeth a little lighter, but they all work on the same basic premise. No matter what technique you use, it kind of works on the same premise. And the premise is chemistry, and the chemistry behind it is it's a hydrogen peroxide compound that we apply to the teeth, or you apply at home. Now what that does, if you remember back to high school chemistry, hydrogen peroxide is H2O2, and water is H2O. So when one of those oxygens jumps off hydrogen peroxide and forms an oxygen, it leaves water. As it jumps, it's looking for another O, so that you can have O2, which is the oxygen that's flying around and the stuff that kind of keeps us alive. But in that intermediate step between when it leaves the hydrogen peroxide and goes to water and oxygen, there's something called the free radical. That's that oxygen looking for another oxygen. It's that little guy that actually causes bleach to whiten teeth. So what happens here? It actually lightens up the surface of the teeth. Now, all teeth will bleach. Some bleach better than others. If you have a lot of gray, everyone's got gray and yellow in their teeth. If you come in with it like a French's mustard yellow, I love those. Those bleach great. Gray is more of an internal color, so you get this opalescent gray from the inside out. That's a little harder to bleach because we're basically treating the outside of the tooth, not the inside of the tooth when we're doing the bleaching process. So what are the different techniques you can do? Well, you could go and get Crest white strips. You know what? If you're diligent about it, they actually lighten the teeth a little bit. It's not a great result, but it will get your teeth whiter. I've had patients come in, I've looked at them and said, well, dude, what'd you do? You know, your teeth look a little lighter than I saw you 3 weeks ago. So now I was wearing these Crest strips. They cost almost nothing. And if you want to start with that, great. Now, if you want to go up a level from that, you can actually have trays made by a dentist. We take some impressions and we make something that looks like an Invisalign tray. And you put some jelly in the tray and you wear it. Years ago we used to tell people wear them overnight, but the reality is you squunch down and all the stuff comes out, and about an hour and a half into your night you've ingested all of it. So I just tell people wear it for an hour or two while you're watching TV or on a computer every night, and it comes in various degrees of effectiveness. Now the effectiveness really has more to do with how strong the stuff is. So if you have real sensitive teeth, you're not going to want to try a 20% solution. You might want to try a 5. On the other hand, if your teeth, you couldn't hurt them if you chomped ice cubes and sucked on ice cream cones the rest of your life, 20 will work just fine. And this works great. Now the only problem with this is compliance. Who's going to remember to put these things in? I mean, I made some for my girlfriend and the stuff's still in the refrigerator, to tell you the truth. So that being the case, what else can you do? Well, you've all heard of bright white or zoom whitening. And those are a procedure that's done in the office. We isolate your gums really well. We put some solution on the teeth. It's activated by a light. In my office, we actually have you lay back and you watch a TV that's on the ceiling. And it's 3 20-minute sessions. We put it on, activate it, take it off. So you're in the chair about an hour and a half, but a dramatic one-step lightening process. Now in my office, we use zoom whitening. To tell you the truth, they all kind of work. Bright Smile is a different business model for the dentist. Doesn't make any difference. Zoom has come out with 3 different machines. I've owned them all. The first one worked well, had a ton of sensitivity. The second one didn't work, frankly, so well at all. Third one, a combination of 2, and we were really happy with the results and the lack of sensitivity that's resulted from it. Now, how long does bleaching last? Well, we make the same type of trays that if you're just going to do tray whitening at home, to send home after a zoom whitening. So every 2 or 3 months, every 4 months, you might want to wear them for one night. There is a little bit of a rebound, but the stuff is remarkably stable. I've been bleaching teeth now for 35 years, and it's gotten better and better, and it's always amazed me how long the results did last. So whether it's just a standalone procedure where we just brighten up some teeth that are otherwise pretty well shaped and evenly spaced, or if it's bleach your teeth in conjunction with a different procedure like bonding or something like that, bleaching is a great place to start. Or even if you're just going to get your upper teeth treated, you bleach your lowers so you can really pick a much lighter color on the top and you don't look like you got a misset set of dentures in, you know, not so good looking. Anyways, if you're interested in bleaching or whitening your teeth, you really need a consult, give me a call, Dr. Paul Coleman, Coleman Center for Cosmetic Dentistry, or visit my website at www.drpaulcoleman.com. I hope this clears up a little bit of stuff for you, and I look forward to talking to you next week. Thank you.